And it's showtime. Hello, everyone, and welcome to another fantastic episode of Understanding CBD. I am your host, Stephen Wallman from Wallman's Apothecary. For those of you that aren't familiar with Wallman's Apothecary, we do very high-end whole plant tinctures made from hemp. And the reason we make it is a lot of the medical cannabis programs don't grow a lot of high CBD varieties. So what we do is we grow very high quality tinctures. We make topicals. And as you can see, we have the lab report. Let's see if we can get that. The lab report right on the back of the bottle, cannabinoids, terpenes. This QR code takes you right to the full panel testing. So just a little plug for my company, Wallman's Apothecary. And today we have another fantastic guest. You've met her before. She's a nurse practitioner. Her name is Renee Reisinger. And it's really funny how things work. I was walking my dogs this morning and ran into a friend walking his dog who doesn't normally walk his dog. His wife normally does. And he said, hey, I don't know if I told you about my wife, why she hasn't been walking the dogs, but she's just finishing up her chemo. And of course, I'm sorry to hear that. And are you suggest she's in cannabis? And he said, no, well, I talked to her about it, but, she's like, no. And, so I pushed a little bit more and suggested some of the reasons why. And, she can use it to help with some of the stress and so forth. She still has radiation to go through. And he said, well, does she have to do the dabs? And right away, I was really just heartbroken because most of the marketing that people see are people smoking cannabis and, doing smoking and doing these dabs, high concentrated THC products. And I right off the bat mentioned, no, you don't. And you actually don't have to get high. The euphoria that comes with cannabis is what some consider a side effect. So today we're bringing on Renee Reisinger. It's a very relevant topic. She's a nurse practitioner. She does a lot of volunteer work and pro bono work on educating physicians and her patients on cannabis when appropriate. And she's going to help us understand a lot of the different routes of administration and then some today. So welcome to the show, Renee.
Thank you. Thank you for having me back to speak about cannabis as medicine again.
That's fantastic. And we get great reviews from you being on here. You're really like an encyclopedia of information. I didn't mention you also are a graduate of the University of Maryland School of Pharmacy with a master's degree in cannabis science. Is that right?
Yes, I felt very grateful and humble to be accepted into the program and to graduate in the inaugural class. And to continue speaking to that, I think it's important for us to remember University of Maryland School of Pharmacy is a state-funded university. And the Medical Cannabis Master's Program was conceived by some of the brilliant professors and our previous dean of the School of Pharmacy, Dr. Natalie Eddington, had the courage to try to roll this out. And then it was approved. It was blessed by the previous Maryland State's Attorney, Brian Frosch. So our Maryland State's Attorney approved the program, Cannabis as Medicine. A renowned School of Pharmacy like the University of Maryland created and executed and rolled out the program. And it's funded by Maryland taxpayers. So I don't think that we can any longer dispute the fact that cannabis is medicine.
That's a great point. And Maryland is going to adult use cannabis, so there'll be more available to or more accessible to a lot of patients with 21 and over. And, it's really important to get educated, speak to people that are educated and knowledgeable about it. And if you do have a condition, this episode here is specifically to help people understand the different routes of administration. The other thing I like to say at the beginning of these is Renee is a nurse practitioner, but no information should be considered as medical advice that we're giving here. This is strictly just for informational purposes only. This is not a diagnosis or treating any type of condition that you have. So we're going to be helping you with information, but please don't take this as medical advice. You have that between you and your doctor.
Correct.
Right? All right.
Correct. So, as a healthcare professional, I think that ethical obligation is to constantly be trying to educate ourselves about different issues in healthcare. Cannabis as medicine is one. So when patients go to their provider and want to talk about, will cannabis help me, or will cannabis help my wife, like you ran into your neighbor who's undergoing cancer treatment, as a provider, really, you're ethically bound to have, an answer for that. So talking about some routes of administration, I know previously we had discussed different types of cannabis, we're going, I think, from hemp, indica, and sativa, because the indica sativa, or so much of it is a hybrid, that I think the industry is moving to a type 1, type 2, type 3. Type 1 is high in THC. THC causes that psychoactive high. You can remember that because tipsy starts with T. That's a simple way to remember THC causes the psychoactive high. Type 3 is high CBD content. CBD kind of basically, it works in the body. I think we're still trying to, scientists are still trying to unlock the mechanisms of action of it, but we do know it helps with anxiety, pain, inflammation. A type 2 cannabis is a mixture of THC and CBD. So those are the two prominent cannabinoids. Scientists are continuing to unlock the secrets of the healing properties of cannabis. There were, last I had heard, there were like 140, 160 different subtypes of THC CBD. And I was fortunate to sit on a panel with Dr. Patricia Fry, and she corrected me. There's many more that have been discovered just in the past, couple years. Terpenes are the sticky stuff on the outside of that female marijuana flower that give the plant that skunky aroma when people smoke it. Different terpenes and different cannabinoids are very important for different disease symptoms and for relieving different medical conditions, improving quality of life. There's other constituents and components in the plant, in the flower, that are still being discovered, flavonoids and other amazing things that scientists are working on. So routes of administration, anytime we diagnose or treat, and if you talk about how to help a patient with a new treatment, then the patient needs to know how to get that into their body. So typically, I think with cannabis having been illegal for years, for most of us, and in particular for me, in the past couple decades before I really knew anything about cannabis, the only way that I knew that people used it was to smoke it. Smoking is a route of administration. I have a book called The Medical Cannabis Primer. It's another great book for new cannabis users. It's chock full of information and has a lot of good infographics. So
wait, before you get into that, it sounds like before you start thinking about the route of administration, you'd want to determine which type of cannabis you should start with, whether you're going to start with a high CBD or high THC, something in the middle. It sounds like that's the first place to start, right? And yes. Do you have any guidance there? Do people?
Yes.
Okay.
Yes. So that's a great question. Before I got ready for this, I was listening to a curbside consult seminar or a webinar that Dr. Dustin Sulak just started. I just love to listen to I feel like I stand on the shoulder of the giants that came before us. But I was listening to Dr. Sulak, talk about cannabis. And for people who have been using it recreationally, to help them shift if they have a medical issue that they want to work with the cannabis with, that's also a population that we want to address. If you've just been using it for recreational use and then you have a new diagnosis, like your neighbor, and if somebody was using it recreationally and now they want chemotherapy relief, that's a whole different type of conversation that you're going to have. And like he suggested, you really want to try to start and get to that lowest dose that gives you symptom relief, so that you don't overuse it and build up a tolerance. So like he was suggesting, a lot of the new or more immature plant cannabinoids, and you can see that here, CBGA, CBGVA, THCA, all these young plant cannabinoids, and CBD are great products. And then you can gradually add in, THC as needed until you find what we call that sweet spot where you get symptom relief, but you're not so high that you can't function.
Yeah, that minimum viable dose is really important to have in your mind as a goal to get started with. So once you selected what you're going to use, you start with with it go slow and low or low and slow or something like that to get started. So you'd start with the smaller serving and then titrate up as needed, I guess.
Yes. And then, he had another good point that he emphasized and that I've observed with patients that, typically people that have chronic pain have trouble sleeping at night. Chronic pain and insomnia kind of go hand in hand. If you don't get a good night's sleep because you're in pain, you don't get that good restorative, REM sleep that you need. One of the things, you can start to work with patients that suffer from pain and insomnia is to help them find maybe some cannabis that'll help them get a good night's sleep, just so you can, wake up, feeling ready to start your day. That's always a good start point. And then for other more complex issues, journaling is always a great thing for patients to do, so they can try to tease out what terpenes and cannabinoids are helping them the best. And then there's also genetic testing, a WeDecode.me from an oral swab that'll help identify what genetic problems you're predisposed to, and that'll also help identify what terpene and cannabinoid deficits you may have. So that's an option also. I haven't had a lot of patients, I think, move forward with that. Hopefully in the future, what we're going to see is we're going to see this rescheduled. So Americans for Safe Access, the national group, is really pushing a campaign. I think it's called Shred the Schedule. And the goal is to move cannabis out of a controlled Schedule 1 drug and reschedule it from controlled Schedule 1 says there's no medical use. Clearly, we know there's medical use. The UN in October of 2020 passed legislation, or they passed an amendment that rescheduled cannabis from a no medical use to has medical use but used with caution. And that's, I think, the goal for many of us, because cannabis is medicine and we need insurance companies to cover this for patients.
Yeah, that's a big problem for patients when they're talking about affordability. It's much less expensive, or insurance is going to cover your pharmaceuticals, but it's not going to cover your cannabis. And you mentioned that the last time we talked, and there was a number of 20-some countries adopted it, but U.S. is not one of them. So this campaign you're talking about, I can spend a minute on it now. This campaign is to educate Congress, is it?
Yes.
Or what's the
Right.
target? So your local U.S. Congressperson?
Yes. So Maryland's chapter of Americans for Safe Access, because we're so close to D.C., met and decided, that we want to become more active with the national group and really get down into D.C. and lobby, because this cannabis is medicine. It's not concierge medicine. Like I said before, it's not, I think, where we want to be as people, where you need to have a disposable income to afford medicine.
Is that what you mean by concierge medicine? You need to pay extra to have more attention from your doctor?
Yes. And cannabis is available, but you have to have a disposable income to afford it. And, every time I turn around, I find this. And there was somebody that reached out to me in the past couple days to help her get a medical cannabis card for her mom, who has a lot of health issues. She had a provider that suggested that cannabis might help because she's got multiple medical problems and what we call polypharmacy, which just means she's on a whole lot of medications and it's not really helping. So we were working through, getting the medical card, and because she is on Maryland Medical Assistance, I thought the $25 fee would be waived. I'm not sure the logistics of what happened, but the message I got today from the daughter who's trying to help her mother is she said, they said that we needed more documentation, or we can just pay the $25. And she said, so I'm not going to be able to get the number for her until I get paid again, and then I'll pay the $25. And I just thought, like,
yeah, it's
ouch.
tough.
Ouch.
Yeah, and I mean, I guess in July 1st, they'll be able to just get it with 21 and over, and in Maryland at least. But no, it's really a problem of getting access to cannabis, which everyone should be able to have, and even grow your own. And soon we'll be able to do that in Maryland. But that's what's really recommended: grow your own, learn how to work with it. It truly is a beneficial plant for medicinal purposes. It's really amazing, and more studies and research is coming out as it becomes more accepted in different places. Just really quickly, I wanted to pop up here before we get to the routes of administration. Eric Stamper gave a shout out to Veterans Initiative 22, Renee Reisinger, because I know you do a lot of work with them.
Yes.
Eric's a great guy. He started that, was the head of that organization too.
Yes.
Tell us a little about Veterans Initiative 22 real quick.
So I'm not a veteran. I'm a veteran spouse. My husband's a veteran. Shanitha Lewis, who is an actual veteran, is the director of Veteran Initiative 22. And she's doing an amazing job. She also is a graduate from the School of Pharmacy, University of Maryland School of Pharmacy, with a master's in medical cannabis. She graduated last year. So she's moving the organization through. We did attend an event last weekend at Ritual Dispensary in Baltimore, and we ended up having what we called the nonprofit corner. It was Maryland's Americans for Safe Access, Veteran Initiative 22, and the Unprescribed, which was founded by veteran Steve Elmore. And anybody who has Amazon Prime, I would really encourage you to watch that movie. If you have Amazon Prime, you can watch it for free. It's called The Unprescribed or Unprescribed. It's an amazing documentary. My husband and I have watched it 4 or 5 times. It's very moving.
I've seen it, and it's really that initiative, Veterans Initiative 22, and what you guys are doing to bring awareness to the polypharmacy of veterans and helping them get access to cannabis and medical care is just incredible. And I support everything that you guys do, and I urge everyone to do what you can to donate, support their activities and events they have. And to get to the main topic, because I know maybe some people want us to get there already, which is routes of administration. And as far as starting here, you started before I interrupted. Sorry, but I thought that there was some things I wanted to cover. It started with smoking, right? Let's kind of start there, because even you thought before you were educated on cannabis, right, the initial thing is people are thinking that I need to smoke something.
Right.
So we can talk about smoking first. So that is a route of administration, and it does apply to some conditions. But maybe you can put it into perspective for us.
So inhalation is a quick method to get medications on board. Anesthesia, in the OR, anesthesiologists will use inhalation for sedation and anesthesia pretty quickly. So any type of inhalation, it goes into your lungs, it gets into your bloodstream. So inhaling any kind of product, the onset of action is seconds. The duration can be up to 3.5 hours. Typically, I'll tell people, when you inhale cannabis, you inhale it, it goes to your lungs, to your bloodstream, and gets absorbed into your bloodstream within seconds. And it can last anywhere from maybe 1 to 3 hours. So for smoking, I think for older people, or people that want to use cannabis as medicine and aren't using it recreationally before they start with medical, if you're not already smoking, I find a lot of people aren't interested in that as their method of administration because they don't smoke cigarettes, cigars, or.
So if it's a condition like that would require something that's immediate onset, maybe like an anxiety situation, you can inhale. So something that you would want a fast onset but doesn't need to last that long would be one of the situations where inhalation might be a good route of administration.
Yes, so I think it's personal preference. If you're looking for quick symptom relief, for an acute symptom, you're looking for that quick onset of action. Another method of administration is sublingual, or buccal is the term. But
yeah, before we move on to that, I wanted to ask you one more question about inhalation. There's obviously you can smoke it. There's also vaping. There's like the term dabs, which was brought up to me this morning, is just a type of vaping. Do you have any like what's the difference? Is it inhaling, or is there a smoking versus vaping? Any difference in a medicinal perspective?
So from a medical point of view, I'm not a big fan of people putting things in their body that we're not sure of. And I know we talked before about, things that are in our food source. And then, the Canadian smoke that we were inhaling last week.
Yeah.
There's things you can control and things you can't control. So as far as vaping goes, it's legal. It's heated cannabis. The cartridges are in plastic, and I know
it's an oil. It's an oil, and typically it's an oil. You can dry herb vape, so I think you can take the flower and put it in a dry herb vape. They call it, so you can instead of a liquid, you can just take the buds and dry herb vape. And I hear that might be maybe the least harmful because you're not combusting the cannabis; you're just heating it up to a temperature that will vaporize the cannabinoids and terpenes. So it may be a more controlled way of doing it.
Yes. And one of the women that graduated in the class with me, her son, they were able to wean him off of all of his medications. He has autism and he's an adult. And she said, that cannabis, really saved his life.
And he was inhaling it?
He was inhaling it, but, she couldn't teach him how to inhale it. So she made a contraption where it heated it, and then he just could put his face over it.
Oh yeah,
maybe
they used to have this old volcano.
Yes,
it's like a tower, and you put it in. It has a fan, and it fills these bags, and then you can inhale the bags, or you can put your face in it. So
it was similar to that.
Yeah, so there's a lot of different ways that you can inhale. It's not just one way, and there's some that are less harmful.
Correct.
Or more tolerable, if you will. I'm not sure the right word, but
right. The vapes that are sold in the Maryland dispensaries are legal. And then I know that you had a wonderful podcast with the chemist
Robert.
Yes.
Robert Thomas.
Yeah. Robert Thomas. Yes. I listened to part of that. I would love to listen to you interview him again. Like every time I read something that he wrote, I always learn something. He had a lot to say about contaminants and, cannabis.
Yeah, the challenge he had about the vape cartridges was that if you have a cartridge that's sitting with a metal element, which is the heating element in the liquid, and it sits on the shelf for who knows how long, it could leach out these heavy metals into the liquid because the cannabinoids, the liquids that are in there, can be corrosive. So it's not something to say, don't do it because, there's harms in everything you do, but you have to be aware of your route of administration if you're going to inhale it. I know we want to limit our time today, so let's move on from inhaling if you're okay, unless you had something else to add to that.
No, I think you could bring, your chemist back and get a wonderful explanation.
Yeah, he's out of town now, Robert is, but when he gets back, I think he had a wedding. When he gets back, we'll get him on the calendar, and I'm going to ping you before to see what questions you have, or you can join in on the conversation as well, because that would be awesome to have both you guys on too.
We want to hear from him again.
Yeah.
So, onset of action, inhalation, and then your other method would be sublingual administration. Because you have these vessels under your tongue. The same idea is given a chest pain patient nitroglycerin, the sublingual drops, because the onset of action is pretty quick with that also. That was why we would give chest pain
patients. Would that be the same as like a tobacco pouch put in your cheek and gum for people to get nicotine?
Correct, but I had not I didn't connect the dots with that because I don't think about chewing tobacco, but you're right.
Okay, but yeah, no, I used to be a cigarette smoker, and in the process of weaning off of smoking, I would use the nicotine gum, and you chew it, and then you sort of pack it in your cheek there to get the nicotine. And so it's that buccal region. It's either the cheek or underneath the tongue, and there's capillaries there. So what's the onset of action for a sublingual?
So I think the onset of action for that is maybe like 1 minute, 1 to 2 minutes. I know when I've given nitroglycerin to patients, in ERs, the onset of action is pretty quick. So same with tinctures. I like to encourage.
How long do you let it sit under your mouth? Is there a certain amount of time, or
as long as you can? Because when you drop it in there and it's sitting there, it's hard to not swallow it, because that's all you're thinking about, and then you just get more saliva. So as long as you can hold it in your mouth.
Well, that's another thing, because we do it. I do it all. Let people when I see them try it for the first time, they keep their mouth closed because they're afraid it's going to leak out. But if you just a tip, if you put it in your mouth and just let it sit there, you can keep your mouth open, and your saliva won't build up as much, and you won't have that pressure to swallow either. So.
Yeah. So for patients that are new cannabis users, I usually encourage, to try a high type 3 content CBD, CBG, CBGA, or, one of those, and dose it sublingual. And some people say, well, I can't tell how much I'm giving myself. So you can always stand in front of a mirror and do it. But what I like about that is the patient has so much control over how much they use, by looking at the drops.
So you can control your dose easily.
Yes, you can control your dose, and then you can go up on, the dose and the frequency until the vial is empty. And if you didn't get symptom relief, then maybe you can add a small amount of THC and go up on that until you find that sweet spot where you get symptom relief that you're
now
not.
On the duration of a sublingual use, how long does the effects typically last?
So the book is saying 2 to 8 hours. I think the duration would be maybe 1 to 2, 1.5. And like I said,
and I guess it would depend on the person. When you're using sublingual, because this question comes up a lot, I don't know if you know the answer. Is there a better time to do it in not a day, but like before you brush your teeth, after you brush your teeth? Should you not drink before or after? Are there any rules around when to do it? It's like the condition of your mouth. Does that matter? Or can you take it?
So for sublingual administration, especially with the CBD, if you wake up in the morning and you're having chronic pain, I would encourage the sublingual use before you do too much of anything else.
So first thing, go ahead and put it in.
If you're having a lot of pain, I would hold off on brushing your teeth and try to get something on board to help you be more comfortable.
Okay, that's a good advice. Okay, all right. So we got the sublingual covered. I don't think I have any more questions. What's the next route of administration you'd like to tackle?
So once people get familiar or are comfortable with sublingual, or if they don't want to try that, or if they just know they want to use edibles, you can go to the edibles. When I say edibles, I'm talking about gummies. I'm not talking about cookies and brownies. I'm talking about gummies. So the gummies that you can get in Maryland, you can, personalize those to the dose that you want. And I always caution people with THC, once you start swallowing THC, unlike when it goes right into your bloodstream with the sublingual or the inhalation, when you swallow that, it goes to your stomach and then it gets transported to your liver before it goes to your bloodstream. So when your liver, when that THC molecule goes to the liver metabolizes it and makes it 4 times as strong as when people smoke it. And then the onset of action is maybe 45 minutes to 3 hours. Depending on what you just ate, these molecules are fat-soluble lipid molecules. So if you've eaten eaten a meal that has some fat in it, the onset of action may be quicker. But for people that aren't really familiar with the gummies and are used to smoking, sometimes you'll hear people say, oh, I ate a gummy, nothing happened. I ate another gummy, nothing happened. And then you can get this THC overload or too much THC. And for some people, not everybody, but for some people, it might cause an anxiety panic attack. So I think people need to be educated about this. Start low and go slow. With THC, once you start swallowing it, you can always take more. If you take too much THC, one thing that helps to dampen the THC molecule off of that CB1 receptor in your brain is CBD. So if you have just plain CBD tincture drops, you can use that, and that'll help lessen or not blunt. I didn't mean to use that word.
Yeah.
It'll help lessen that THC THC.
The experience, like if you're,
Yes.
I understand what you're saying. I also heard pepper is good if you chew on peppercorns.
Oh, okay.
That also helps with the CB1 receptor.
Mm-hmm.
But nothing is instant. So if you do have that experience of paranoia that you maybe used a little bit too much THC, that the best thing to do is kind of relax and calm down. Understand that it will subside. It takes
Yes.
a little time, and I'm glad you made the distinction between sublingual and oral, because a lot of times people hear oral route administration, and they don't know the difference between letting it sit under your tongue in the buccal region for a minute or so, as long as you can, versus swallowing it. And then the other thing is, which I don't know if a lot of people knew this either, and I don't even know if I know the answer to this question, but THC, when you ingest it, it seems to enhance the euphoria, the high you get from it, and it's going through the liver. So most of the time, the liver might break down. Like from what I understand, if you're ingesting CBD, that you'd want to take more CBD if you're ingesting it. Did you have any comment on that?
So for the CBD, I've been a big fan of the sublingual administration. I have used your CBD gummies that you have. I love those. I need to order more for daytime use. But going back to the THC overload, so I always tell patients, if you ingest too much THC and you have that anxiety panic attack, this is not an opioid. It's not going to cause you to stop breathing. You're going to feel uncomfortable for a couple hours. And I don't want people to have a bad experience and have it turn them off cannabis. But there's no receptor in your brainstem that's sensitive to that THC that's going to cause you to stop breathing like opioids do. And I think when recreational starts, we really want to try to keep these high THC content products away from children and pets, because their small bodies just can't handle, and we don't want our ERs overloaded.
And THC is toxic for dogs. They can handle a little bit like in a hemp product, but and again, your point is really I'm glad you put it out there that you can overdose on THC, but it's not going to kill you. So there are symptoms of an overdose, and you mentioned some of them, but it's not going to be something that's going to stop your organs and kill you.
Right, but we need to be cautious, especially with children and toddlers.
Absolutely, because the gummies are gummies.
Yes, the packages are childproof, but I've had children that could get into things that I never thought they could get into. So.
Okay, yeah.
Yes.
All right, so we've covered inhalation, we've covered sublingual and buccal, we've covered oral. What else? Is there anything else?
Topical is a big route of administration. I was a big fan of topical cannabis patches.
Wait a minute. I thought of something. Maybe on the oral, as far as duration goes, is there a time frame that oral absorption works? You said onset of actions around 45 minutes, potentially, depending if you ate something. How long does it stay how long is it active?
So it depends on a person's, GI function. It may be active for maybe 6 hours. It depends on how fast your GI tract is working, what other diseases, might affect that.
Okay, thanks.
That's a good question.
Okay, good.
So skin absorption is another method of administration. When you talk about functional medicine, you think of what is it that our body systems are exposed to in the environment that get absorbed? So our skin, anything that touches your skin gets absorbed into your body. Anything that you inhale gets absorbed into your body, and anything that you eat. Your GI tract is so important, to how you feel. So anything that you put on your skin topically will be absorbed. If you use a topical cannabis product, medical cannabis, like half THC, half CBD, it's been effective for localized pain. I've also found that it's been effective for people for insect bites, poison ivy. I have read some articles that said it's more effective in MRSA-infected wounds than any of our antibiotics. Cannabis has just been, underrated, and The stigma of using cannabis needs to go away. I know I've said this before, and like when I come on your show, I feel like I say the same things again and again, but I just feel so strongly about it. When you educate yourself and you educate your patients and the population about the human endocannabinoid system, which is the master regulator of every other system in our body, everybody should be talking about this. The cannabis can upregulate, downregulate it, but it's so important to how we feel. And it's like a conductor in a symphony, because the endocannabinoid system is constantly upregulating and downregulating, every body function. It's affecting every cell. And in fact, I saw a woman today for a home visit, and we were talking about her blood pressure because she was hypertensive. And she said, well, how come every time I check my blood pressure, it's different? What a great question. Because your body's constantly in a state of trying to maintain homeostasis. And, a theory, a hypothesis is that when we don't feel well, that our body's in an endocannabinoid deficit. So the quick Band-Aid fix is plant cannabis. Other things we can do to keep our endocannabinoid system healthy and tuned up, a healthy diet, stress reduction, exercise, and meditation. And all four of those are hard to do in our Western society. But those are all things that we can do to try to keep our endocannabinoid system healthy.
Yeah. And not to get us distracted here, but there was also a study I saw recently that showed as we age, our endocannabinoid system ages along with it. So it does produce less endocannabinoids, and the receptors aren't as high performing. Not that we probably didn't know that as we age, things break down. But yeah, it is related to that as well. So
and one other thing, may I say one other thing?
And I don't want to. The only reason why I'm moving us along is because we're at 36 minutes, and I promised you we'd stay to 30 minutes. But as long as you're okay continuing to talk a little bit.
So, now that we just broke down the endocannabinoid system and the deficit, the stigma of using cannabis as medicine needs to go away. A lot of people that are using medical cannabis just want to feel better, don't want to get high. Would you ever shame a diabetic for using insulin? Why do diabetics, type 1 diabetes, why do they use insulin? Because their pancreas doesn't make enough. Would you shame a diabetic because they use insulin? That's preposterous.
Shame on you if you do. I mean, that's not fair. All right. So topical, when you're using cannabis topically, you mentioned, selecting the variety that's always there. And you mentioned it for, localized pain. There's also area, they have these transdermal patches or, for absorb, the skin does absorb things. Are there better, if someone wants to, because I heard people putting it like put a patch or a tincture on their wrist. Like we put perfume and so forth on our wrists because it's thin and it absorbs in, or the bottom of the feet. And you also brought up something last time, the belly button. That's topical.
Right.
What do you call that?
Right. So that is a method of ingestion. I haven't heard a lot of anecdotal, feedback from that. So if you use that, you just want to make sure you're not putting something, on your skin that's going to be irritating. So you want to know what's in the product.
Got it. That's important too, because there are a lot of topicals that could have additives that may not be cannabis related. It could be another herb. It could be alcohol. I know we use an aloe vera gel, which is good to absorb into the skin. It's also good for bug bites and things like that. And the conditions that you would suggest it for would be more of a muscle joint pain, or would you think like, and the other question is, can you get any euphoria from a topical?
So that's a good question. When you use it locally, there's not enough THC absorbed that I've heard of from patients, giving me feedback. What I did here, I had a patient with an autoimmune disorder that used a THC Epsom salt bath soak, and she's rather petite and she's a rule follower, and it was marketed for 3 doses. So she used a third of it. And she said it worked really well. People with autoimmune disorders or chronic pain, a lot of times would use like an Epsom salt bath soak at night, to help them relax and try to get a good night's sleep. So, the THC was maybe an added benefit. But she told me that it works. She said, she got good pain relief and she slept really well that night. But she said it was too much THC. And she said it made her really high and she had trouble getting out of the bathtub. So when I talk to people about that, I just always caution them to use a smaller dose than it calls for. Because, one thing, like I never want anybody to fall, whether cannabis or not, fall prevention is a big part of,
Tea for tipsy.
Yes, tea for tipsy, yes. And then when I was just listening to Dr. Dustin Sulak, he said he always would caution people about a fall risk with too much THC. He said that I've never had a patient tell me they fell from too much THC. And I haven't either, but, as a nurse and a nurse practitioner, I'm always concerned about, fall risk for people. So the THC Epsom salt bath soak, start low and go slow. I did get feedback that it helped, with a good night's sleep. And I think that anecdotal, story that I was told by the patient is because it covered a big body surface area. And then I think when we spoke last time, we were talking about beauty and wellness and cannabis. So topical cannabis definitely has a place in medicine, and I think you're going to see it more and more in the med spa industry. The Cannabis Spa Association. Last time, I think I fumbled with what that was called.
Yeah, no, you did. You mentioned it. Yeah,
Cannabis
you mentioned
Spa
that.
Association. It's California was where it originated.
The duration for a topical, how long would you expect it to last? I know there's a lot of different choices with topicals, and even putting something sublingual technically is on your skin, but when you put something, let's say, I'm getting ready to play around a golf and my low back we get a lot of people with low back, and then like shoulders, knees, elbows, that kind of thing, hands, arthritis. When you put it topically, how long should you get out of that application?
So the book that I'm looking at said topical, the onset is minutes to within 20 minutes, and it can be 6 to 8 hours.
Okay.
I know I had a patient that used the topical medical cannabis. It was half THC, half CBD. Put it on his knee for bone-on-bone knee pain. And he got about, maybe 12 to 14 hours of pain relief with it. And he used that until he had a knee replacement. And the beauty of that with him getting, pain relief, before he was a borderline hypertensive. And then when he started using the cannabis and, he was more comfortable. He wasn't in chronic pain all the time. His blood pressure was normalized. Now a word of caution about that also. And, this was a family member. So once he got pain relief from the bone-on-bone knee pain, pain is a warning also, right? So because he didn't have pain, he was doing things he probably shouldn't have been doing. And I know I saw him fall twice. If he fell more, I didn't hear about it. But so I was kind of glad I saw that, because then I could caution people, just because you get pain relief from your shoulder, if you use topical cannabis, still respect the fact that you have that joint damage there, and you don't want to damage it more by overusing it.
Yeah, I'm so glad you said that. I ran into that problem when I was using anti-inflammatories, because I would feel better and I would go ahead and do things, and then afterwards I would pay the price.
Right.
Because I still had an injury and it hadn't healed yet. And a lot of this, you're not promoting cannabis as something that's going to, cure this or heal this, disease here, that the problem you have. So we've covered quite a bit. There's one question. There's two questions I have. One is, is there any other routes of administration that we haven't talked about? And the second question is, just so I don't forget, is when you're taking cannabis along with any other medications, is there anything to look out for?
So when you're taking other medications, you want to talk to an educated healthcare provider, or Maryland requires medical dispensaries to have clinical directors. So if somebody goes to a dispensary and they have a question that the people at the dispensary can't answer, then they could always ask to speak to the clinical director at that dispensary. I personally know a nice amount of clinical directors, and they're very passionate about what they do, and they're very knowledgeable. And I would,
and pharmacists also are a good source to talk to as well.
Yes.
If there's one available. Now, any other routes of administration that we didn't cover?
Yes. So I think what you're seeing in Europe is you're seeing rectal and vaginal administration for different methods. I did have a woman, a mother-daughter patient, and the mother had a GYN surgery, and she was getting GYN cancer surgery. She was getting excellent symptom relief with cannabis use, and her daughter educated herself about how to extract cannabis from the flower, and she made rectal suppositories for her mother so she could use the cannabis post-op. And she said that her mother had an excellent post-op course.
What's the absorption rate on that? Like, what's the onset time?
I don't know. It's because it's not real popular in the U.S.
And, I would think it would be fast. I would think it'd be pretty quick on a rectal.
Right. Probably, like if you looked at, the absorption rate like of a Tylenol suppository, it would probably, be the same. And she mixed it, the carrier that she mixed it with, I think, was coconut oil. So you just have to be sure somebody doesn't have an allergy to what you're mixing it with.
Sure.
And then I've heard different people in the industry, people that I look up to, have different thoughts about it. One person has said, it's very popular in Europe. If people are using it in the U.S., it's not something I'm hearing people discuss.
Yeah.
And then somebody else said that they didn't think the route of administration was really, or the absorption of it was really that great, and that you're just putting money in something that you're going to excrete. So I don't have a straight answer for that. I think as time goes by, you're going to see more routes of administration. And having worked in family planning and GYN care, and I spent a fair amount of my career doing pap smears. So I do think, and I do hope that in the future we're going to see cannabis used to help with some of our abnormal GYN issues. And in fact, when I was listening to the lecture I was telling you about with Dr. Ethan Russo that I listened to yesterday, he had time for questions and answers, and somebody said, where do you see the need for the most research? And he said 2 areas that are really under-researched are cannabis and OB and cannabis and GYN. And he said, the third is psych. And I thought that's really so true.
Yeah, women's health is a big topic. We actually have a guest. I'm booking Dr. Benjamin Gonzalez. He's also an MD in Maryland. He's focuses on women's health. He calls himself the medical feminist. Okay. And he's going to come on and hopefully give us that. I appreciate you staying on this long. We're about 17 minutes over what I promised you, but I think I promise you it'll be worth it. Before we go, though, I want to show a couple comments that we've gotten here that this is Veterans Initiative 22 heard us talking about it. So they're really proud of you, Renee, for being on the board and all that you do. You're literally saving veterans' lives every day with your work. So a good shout out to you from Veterans Initiative 22. We appreciate that. We also have a comment from Paul F. Lawler, and he's saying Renee is dropping so much alpha. And I guess that's good, right? Alpha seems good. It's fire, and he's got the loving hand sign there. So you are making a difference. People are listening. I really appreciate you joining today. Anything on the way out here that you'd like to close the episode with?
Yes, I love what you're doing. I love the variety of topics and, the quality of the speakers that you're bringing in, so keep up the good work.
Thank you. Thank you very much, Renee. I mean, it means a lot, and I appreciate it. And on that note, we're going to end this. Stay tuned. We'll be back again with another episode tomorrow. Actually, tomorrow we have a coffee talk with the CBD recipe guru to help people. People don't forget to take coffee. You don't forget to drink coffee in the morning, but patients aren't always compliant with their medication. So incorporating cannabis in with your coffee is a way to not forget to take it. So we're going to learn some tips and tricks from the CBD recipe guru. So hopefully you guys join us then. Renee, thanks again, and get to your family. I can tell there's someone there waiting for you very patiently. So enjoy the rest of your day, and thank you, everyone.
You too. Thank you.